Over the last decade, digestive sciences has made a dramatic advances, both in terms of technology, techniques, advance in basic sciences and so on. All this has of course resulted in better patient care. I think in addition to these advances in basic sciences, there is a tremendous understanding that there are many diseases of the gastrointestinal tract which not only affect the gastrointestinal tract but also affect other systems in the body. And therefore, this inherent ability of the GI tract to influence various systems is now being considered as very important. For example, the microbiomes, the bacteria in our gut are 10 times the number of cells that we have in the body, and they influence a variety of diseases in our body. And therefore, I think this understanding has led to I think a more intense search for the disease pathophysiology, and this is being translated into patient therapies. So when patients come to us, they don't come with a single disease management. They don't come just with a liver problem or just with a gastrointestinal problem. They come as a patient as a whole, and it's important that they are looked at as a whole. And that's the reason why it's very important that all these societies get integrated, and for programs like this, like the ISGCON, they come together to create a complete program which includes interaction between these specialties. In this year's ISGCON, Coffee with Experts is going to be a very unique experiment. I think it's very important to have this because what happens in large conferences is the younger colleagues or students don't have the opportunity to have a one-on-one interaction with experts because there's some certain distance that's maintained. In sessions like this, Coffee with Experts, this barrier is broken, and there's small groups interacting with experts, and many of these younger colleagues and students want to have the doubts cleared or want to interact more intimately with the experts, and this gives a great opportunity to do this in a very casual manner instead of having a formal conference. So I think this is a very, very important addition in the current ISGCON. I think this year's ISGCON scientific program is a good example of how we can convert both the basic science knowledge and clinical knowledge into patient care. The so-called translation has been done very effectively. It's very important that whatever we have advanced in basic science, in technology like in endoscopy or in clinical medicine is actually translated into real patient care. And I think each subject has to be looked upon very carefully so that this translation occurs. And if you look at the program this year, I think this has been done in a very nice manner, and I'm sure that a lot of delegates who attend this conference are going to come away with clinical knowledge that can be directly applied to the patient. As I look at the program of ISGCON this year, I am quite excited. I think this is a program which has been created with a lot of thought. I think it's going to be a program which is definitely going to benefit all groups of gastroenterologists. I know the people behind this program, they have done an excellent job. Both the ISG Scientific Program Committee and the organizing committee headed by Dr. Randeep Sood, I think have done an excellent job. And again, knowing the capabilities of Dr. Sood in organizing conference, I'm sure that not only will we have an academic feast, but we'll also have a social feast. And I think academically, I'm looking forward to a very productive and a very informative meeting. And I'm sure that it will benefit whoever comes to this meeting.